Okay, welcome to Digital Health Weekly, brought to you by Luma Health, where we will discuss all things health tech. We strive to provide relevant content, practical advice, and useful information for our community of providers, clinicians, administrative staff who are impacted by digital transformation. As usual, we'll record this. We will make the content accessible to our community of customers and those that are interested for your learning. I'm your host, Dave Smith, and today's episode, we're thrilled to welcome Kim Martinez, the operational leader at Aspire Allergy Sinus. Thanks, Kim, for making yourself available for this discussion.
Of course.
So, as we start the dialogue, I would love for you to share a little bit about your background. What led you to pursue a career in healthcare? Take yourself back to that moment of time where you said, okay, this is for me, this is what I want to do. My passion and skills are kind of X and Y meeting at this special industry. Walk us through that moment. Walk us through a little bit about how you came to be in the role that you're in.
So I've always had a passion for healthcare, but I think where it kind of hit the hardest was when my father got sick. He had cancer, and a lot of the experiences that we went through at some of these clinics were kind of detrimental to how his quality of life was. And for me, that kind of sunk in pretty heavy. And I knew that I've always wanted to be on the clinical side, but when I went through that with him, the operational side kind of spoke to me a little bit more. And knowing, regardless if it's allergies or, you're getting cancer treatment, I knew that I could make a difference, and that whatever it was, I wanted patients to experience a better quality of life, and, they enjoyed the care that they got. Because I know that when I went through this with my dad, it wasn't the same experience. I never wanted someone to feel that the same that we did.
Yeah, thank you. I mean, there's a lot of depth in that, in your answer, and I could see the emotion in your face as you're describing that. When you think about the impact that health tech in particular can provide as an operational pillar to connect patients to an experience, how do you think about that? What are some of the adjectives or the things that you say, this is what I really want it to be?
Mhm. I feel like it's given us opportunities to be able to see patients that necessarily be able to see this type of specialist or any type of specialist. I know, like, for instance, if I would have had this available or been presented this to be available when it was with my dad, I feel like we could have seen a little bit of quality of experts in his area. And so our industry, we use this as more of a tool because, for instance, our surgeons, they can't be everywhere in Texas, Colorado at the same time. And so it's given us the opportunity to be able to connect them when patients wouldn't want to be able to meet their surgeon, because our setup is a little bit different where they see our mid-levels first. So I think just giving everybody the opportunity to give all specialties of care when necessarily you can't get to all of those care.
So thinking back to when you started this journey, if you could go back and give yourself advice, knowing the experiences that you've accumulated as a leader, good and bad, what would the words of wisdom be that you'd share with yourself as you were just getting going?
I think involving yourself in every aspect of a business. I mean, in the beginning of my career, I was just focused on my role in itself. But I think as I evolved and matured in my career, if I could have told myself one thing is involve yourself and learn every role and how I can be a better leader, and offer more, and more to my staff and allow them to grow as well. Because I'm a proponent of, if I'm going to tell someone how to do their job, I have to know how to do it myself. So now I involve myself in everything that touches our clinic, whether that's telemedicine, because I've been on the scheduling side, and now I'm on more of the clinical operational side. So it is one part of the business affects the other side of the business. I think understanding that is important.
So how do you maybe give us a definition of what an operations leader is today? What do you do? What are the functions that you're supporting? I think that would be instrumental, because obviously the term has not only changed but grown dramatically
Yeah.
as businesses like yours have found growth and success through M&A, through organic growth into multiple states. And so I'd love for the audience, for you as an operations expert and leader, to just share a little bit about, what is it that you're accountable for? How do you see your role evolving?
So my role, whenever I first took on this, I was clinical operations in the Dallas, Texas area. And that involved, working with our marketing reps, different ways that we can market our providers, grow the business, establishing new clinics, new providers as they come on board, really looking and digging and managing to our P&L is really important. I come from a data analytic background, so anything data speaks to me. And really just overall of the clinic. We have clinical managers as well that are under me. And so they're seeing the day-to-day, and I'm kind of seeing the overall picture. How are we going to get to the next step? What improvement can we make? Or what can I try in our market that may work in other markets? And kind of go from there. And then just recently, I took over our Houston area in the Midland, Odessa. So it's really, different markets. And I think that's going to allow me to expand my career as well. And not every clinician and not every practice can be, or location can be way. It's based on your patient population. And so I think adapting to the change, but it's really now evolving to more of getting the Houston side up, because it's a newer market. So it ranges from making sure that our established markets are functional, that they are profitable, and then on the opposite side, starting from scratch with new providers on board and getting them up and running and get our clinics busy.
Thank you for that.
Yeah.
I'll circle back on that in a minute, because there's a general shift in theme right now in healthcare, as obviously we'll get into a little bit more about the digital disruption that was COVID, and what's to come after. But I think there's definitely more there we can unpack with existing versus growth, and how you're thinking of running your business more profitably, because you have this toolkit now. So we'll circle back on that. For the audience, maybe just give us the Reader's Digest of Aspire Allergy and Sinus. You mentioned a couple of markets you're in. So share with us a little bit about the business and where the business might be headed.
Yeah. So we originally started out as Texan Allergy and Sinus Center. And we are probably one of the very few independent allergists that do both allergy and ENT services. But I think at the forefront, which has allowed us to be able to grow into different market areas, is that we're always on the forefront of innovative solutions to offer to our patients. When you look at the amount of people that suffer from allergies, only about 2% of them actually get treatment. So we have to make sure that when we do reach out to these patients and do get them in our clinic, that we make it the most impactful. And I think that we've done that, and I think it's proven and shown and how we've been able to expand. So we took over some clinics in Colorado, and that's when we changed our name to Aspire Allergy and Sinus. And we've expanded our clinic offerings in the Houston market, in San Antonio, Austin, Waco, several different areas of Texas. And most recently, we've gone into Florida and New Mexico with more to come. So I think it's just, we as a company have, that we're innovative. We're always looking for the next best thing when it comes to our patient care. And I think take us places that, our executive staff is hopeful for.
Wow, that's a heck of a growth story you have there.
Yeah.
It sounds like they're preparing you for bigger and bigger things. So that's awesome.
Yeah.
So share with us, given where the world was last March, and I would just love for you to paint a picture of how the business was February of last year, and then what happened in March, April, and what did things really look like at your business as you were interpreting the signals of everything going around you. I ask this question of every leader that we bring on, because I think it's fascinating to learn the experiences of how everybody dealt with this influx of this thing that turned obviously into a pandemic. Would love for you to just take us into the water and walk us through what was going on last March.
Yeah. So, when the pandemic truly hit, I think everybody felt the same pain that every other clinic has felt. And we initially, because of how hard it hit, we closed our clinic for about 2 weeks, and we used that time to look at how we can continue to run the business efficiently and still offer most of the services that we can. But with giving patients a peace of mind that, one, they aren't going to have to come into clinic. And then two, when when we first closed, we looked at what services can we offer and how can we offer those. And that's when we started exploring telemedicine. We always had a very small patient population that we use for telemedicine, but not to the capacity that we've used it now. And so to help kind of bridge that gap, because we were about to hit one of our busy to nothing, we looked at, can we offer any type of consults for our patients? Can we offer sick visits? Because a lot of people, can get confused between allergies and COVID. And so just, easing our patients, giving them a peace of mind between the two. We have a lot of patients that are on food allergy treatment. So we could, still offer those services through telemedicine. We actually went through a program where we did our consult for allergy via telemedicine, and then offered an at-home test to help bridge that gap. So it really, I believe that, until we were able to open, if we didn't have telemedicine, I don't know that we'd probably be sitting here talking to each other. It really was a huge impact, and I'm sure it was buddy. So, looking forward, have we been able to still utilize those services and kind of where we're at now. I think that our executive team and our management team strategizes together, has allowed us to be able to grow in this time that we're in now. And through that, we're still able to offer a lot of our services through telemedicine. There's patients that still, with the schools still being, some parents want to keep their kids at home to do online learning.
Yeah.
Or it's not as easy to go up and pick up your kid to get to an appointment. So, we're offering later injection appointments. We still offer the food allergy, treatments via telemedicine. We still can do sick visits and sinus consults. And then one of the biggest things that we've utilized it for, especially in markets other than Austin, is to be able to connect our sinus patients to our just because a lot of them obviously want to meet the surgeon before they come in and have surgery. And so we can use that as a time to connect them to essentially face to face or screen to screen and get to know each other so they feel comfortable the day in that they come for surgery.
So thank you. What a great answer. Let's unpack a couple of those. I think it's beneficial to go through. So, you mentioned telemedicine, right? Telehealth, the ability to virtually connect, and so going back to March, April, with the you mentioned the easy to confuse symptoms and the lack of education and knowledge, really, which was prevalent everywhere. I think there's three things I would just love to explore with you in whatever order you'd love to just give us your thoughts on. One is the mental health of your staff, your teams, the providers, of knowing that that while having allergies to some people is just I scratch my arm when I touch a fabric that gives me that, to all the way to where parents deal with life-threatening conditions that are very chronic. And so the gamut of the patient experience, right? I can understand the patient saying, well, if something is really chronic, then this isn't a nice to have, it's a necessity that I have to deal with. And so would love for you to just share your thoughts on the providers, how they interpreted that shift. Were they open to it? Did they view it as a necessity? Did they embrace it? Was there an adoption curve there? And then the same question for the patients, which was, the first time you do a telemedicine visit, it's an abnormal thing because you're very used to a different flow of conversation and feeling, right? And then the mental wellness and health of your staff. So we'd love for you to walk us down those three aisles and share a little bit about that, if you wouldn't mind.
Yeah. So I think the adoption, I think it's based on the platform and the ease of use that you are providing the provider. We use Luma, but the previous platform that we use gave anxiety to most of our providers. And I think that having a tool that is easy for you, both on your side and the patient side, relieves a lot of that anxiety. And I think it allows for an adoption rate. We had a provider that would prefer a paper chart over technology.
Right.
And the ease of use, he loves doing now, and enjoys the interaction with his patients when they can't come in. So I feel like our adoption was pretty successful, but I think it all has to do with the tool that you're using and how quickly, can you get a provider added? How quickly can you get them trained, the tools? So I feel like that wasn't probably, one of the hurdles that we had to overcome. As far as moving into, the health and mental health of our providers and our staff, um, it's all in education. I mean, we have a great provider, and she, heads all of this as far as compliance and all of that. And she's big on education, and I think that has helped ease a lot of the staff and the providers. I know when we first came back in the clinic, and you talk about the COVID vaccinations and moving into that, and being such a controversial issue with, a lot of people and on both sides of the spectrum. Through education, I think even if it's not right away, it will eventually speak to the person that may be having a harder time understanding, and wanting to truly understand the impact. And I think that we've, through all of this, been very flexible with our staff and our providers. They have families and life too. And I think that has a lot to do with it. Our executive team did an amazing job at communication. And I don't think that if we wouldn't have that communication with our staff and ability and educational opportunities, that we would probably have the staff that we do currently. And one success story is I had a medical assistant in one of my clinics, and we've probably out about 15 to 20 different videos and educational opportunities on COVID vaccine and the importance of not just them getting vaccinated, but their and all of that. And the last video that we sent, I had her she sent me a message asking if I could help her find somewhere that she could get vaccinated. And she wants to get her grandmother and her vaccinated because that video really stuck to her. So we have a great team, but I think that number one is just education, training, education, training, education, training.
Yeah. And so your story is near and dear to my heart. So I have a really good friend that is that's one of the leaders at Kimberly-Clark Corporation, and they make diapers amongst many, many other products. They're an enormous company, historically, a blue chip company, and so he leads governance and compliance. And the way that he leads governance and compliance is every single employee gets shown a internal video that they created as they make diapers for preemies, because the emotional connection to understanding that the work you do is likely in this scenario going to be the very first thing that touches a preemie's body, and might be the only thing that touches it for months, providing a connection point. And so this education, this story that you just shared about 15 videos to finally get somebody, is such a great transitional narrative to I said I wanted to circle back to growth. And I have heard over and over again from leaders like yourself that, hey, the genie's not going back in the bottle. For a year, folks have used DoorDash, they've bought their groceries off Walmart delivery,
Me.
Yeah, exactly. And so what we have come to understand is, the mobile phone is our best doorway for efficiency and productivity to get us to the quality time we want to do with something, right? And so knowing you have this growth, knowing that you're in multiple states with a transformative business plan, but also knowing that you have patients that are just like, you know, the employee, that some jump on that wagon and feel really comfortable using telemedicine or online scheduling or SMS communication, right? The kind of, we'll call it that modern way, all the way
Right.
to those that are going to need this constant communication and assurances and training and education. Tell us a little bit about, how do you see digital transformation impacting your growth goals, your cohort of patients, because they go from very young, obviously, to very
Mhm.
old. You have different demographics, you have different language, you have different, scenarios where there's caregivers involved. That seems a heck of a lot. And so
Yeah.
walk us through how you think the lessons you've learned this past year will apply to making you more efficient and more effective at reaching your goals, but providing a better patient experience.
I think, one of the lessons learned is always looking at using multiple communication methods, whether that's text, email, and social media, those type of things. You, like you said, range from someone that doesn't doesn't go into text, they only do email, or vice versa, or they want to be able to look things up on the internet. So I think you have to adapt to all of those, not knowing, you may have someone that is 30 years old and you just assume that they are going to go through their text, but they might be someone that prefers. And so I think you have to adapt to everybody and use that to we use it for how we get our sorry, I lost my train of thought.
We,
How we
you
get
get
out
it.
our medication rule. We've educated patients on how we're going to keep them safe when they come into clinic. We send out videos from one of our providers talking about the allergy season, allergy versus COVID, those type of things. So I think it's just accommodating to the masses and not just thinking that because we're, in 2021, that everybody should be using text messaging or social media. I think it's just making sure that you stand your ground and kind of fit everybody.
Yeah, for sure. Do you, so what are the advances if you could sprinkle magic dust on technology companies like Luma? And you
Mhm.
said, hey, Luma, if you could like do these things faster, what would those things be and why? What is it that you would want the tech community to deliver that would make this patient experience, this connectiveness, going back to your purpose of even getting into the role you're in, and the recognition that technology could have made that experience you were going through potentially different?
Mhm.
Is it, and I don't want to lead the witness, but is it deeper EMR integration? Is it forms? Is it payments? Is it all in one? Is it, um, tell us a little bit about what your dream list would be.
My dream is all technology would speak to everybody, but to everything. But I think you're always going to deal with limitations by one of them. And if I could have, anything work or be possible, it would probably be deeper in with our EMR. I mean, we transitioned from a system that was pretty close to a DOS based system, looked like. I mean, it wasn't that bad, but um, to next gen, which offers so many different bells and whistles, but still has limitations. So
Yeah.
being able to integrate even closer into between Luma and next gen would, I think, make things a lot more seamless for us. as far as the patient communication. Um, you know, one of the things that we deal with, and we're limited by Jen, is when we have a block on a schedule for a provider, but we haven't got a hold of the patient. Um, the limitation that we get from our EMR and the connection between Luma, we aren't perfect in our communication, and we have patients. So that's probably the biggest thing. I think communication is key and so just if we could, have that tied together a little bit closer, I think that would probably be my wish list.
Yeah. Yeah. I mean, you're speaking obviously to the innovation in general in health tech, in the health tech industry, as the transformation, which, I've heard. I would actually, instead of me asking, if you were to tell somebody in the year 2020, how many years, is it 3, 5, 10? How many years do you think we skipped in this digital transformation in 1 year?
At least probably like 10 years.
Right. So if you look at that, the EMRs are at a spot where they're going to continue to become more and more open. That way,
Right.
that way you get more benefit out of it's about returning economics back to the system, right? You spend a lot of money, both politically, financially. We hear this time and time again in doing EMR, and it's how do I get more out of that so that my capital efficiency of that investment is richer over a period of time. And it's a double-sided benefit, as you mentioned. The patient wins because they're able to do things at their convenience, and then the business wins. So
yeah, oh, sorry.
No, please go ahead.
No, I just, it's almost as if, you have to really dig into all of your technology, because there's things that we probably still don't know or EMR about Luma. And I think that, as a leader, I've had to really dig into how we can utilize it. If, one system's not offering us one thing, how can we use it to, get the result with the other program?
What advice would you give another operational leader when they're considering their partners and who they pick from a technology standpoint?
We've always put together a team, and that team includes every department, from billing to our front desk, to our MAs, to our providers, schedulers, triage. And I think that's probably one of the most important things that you can do. A leader, yes, you should know what you're doing in those departments, but you're going to know how one thing might affect another department. And I think having a group that can speak to each other and work through those and come up with their list of what's most important, what's going to allow them to make things easier for not just their department, but it might work for another department. So that's been one of the probably key points in our success. And that's how we chose our EMR. That's how we chose Luma. And I think it's proven to be successful for us.
Yeah, those are wise words, because we hear time and time again, Kim, the benefit, the game has changed where implementing technology to do one thing, point solutions just don't really scale anymore. People are looking at platforms that do many things, and those many things then obviously touch, if you think about that as a center of a Venn diagram, they touch many functions. And I think you're a lot of wisdom there. So I appreciate your time so much. In conclusion, what gives you hope for the future of healthcare?
I mean, healthcare in general is obviously always going to be there. But I think that how the industry has adapted to so much change in the ever changing market that it is what makes me hopeful. If when they conquer one thing, we're going to start working on another thing. I mean, it's the same in any industry, market, any. There's always something that you can improve on, and I feel like healthcare is probably one of the leading industries that is always kind of 2 steps ahead.
Yes. Yeah. And I so appreciate your thoughtfulness and your personal journey into what you're
Yeah.
doing. As a father of an asthmatic child that deals with allergies, thank you for the work that you all do and the innovation you bring to the communities you serve, but also for your helpful tips. And we're so appreciative of that. Thank you, Kim. Really
No,
appreciate it.
thank y'all.
All right. Was that bad?